Hi everybody, welcome to another Chats with Children. I hope you're safe and well. Today I'm talking to Anne McGee, who is president of PDA Ireland, and we're going to be looking back at 2020, but also more importantly looking ahead to 2021 and looking at some of the trends and so on. So Anne, thank you for joining me today. It's lovely to see you.
Yeah, good to see you as well.
Great. Well, I think there might be a little delay, but don't worry. I'm guessing you might be going to delay my answer questions, so don't worry about that. So, thank you for joining me. Obviously, we're going to look back at 2020 and look ahead to 2021. But before we do that, for those people who are not familiar, I'm sure people are familiar with the PDA overall, but just in case, perhaps you can give a quick background on PDA Ireland and your role and background as well.
Sure. My own background, I'm a pharmacist by training, and I've been in the pharmaceutical sector for about 36 years now. It's too long. I have to stop telling the number of years. It's too long.
But you don't look it, I have to say, so don't worry.
Oh, well, thank you very much. Divided between, I was about 10 years in various technical roles within the industry, and then I became a regulator, and I held a few different roles as a regulator, a total of about 11 years, and then set up my own business, first business in 2004, which was to provide quality and compliance advice and guidance back to the pharmaceutical industry internationally. So I was lucky enough to be able to sell that business on in 2017 and set up another business. So I've kind of been in the area for this long, advising on best practice standards for the manufacture and distribution of medicines. So in terms of my role in PDA, I am the president of PDA Ireland at the moment. This is a second year of my term, which finishes in November. And within PDA has a number of chapters worldwide. And within Europe, Ireland would be one of the most active chapters in Europe. And my role as president, as I see it, is to support, direct, guide the chapter and its committees, who are very active, to provide education into the pharmaceutical arena around new technologies, advancements, regulatory developments, regulatory requirements, to all with the aim of ensuring quality of medicines. So in the role of president, it's about enabling that, facilitating that, making sure that the standards of the educational seminars and courses that we provide are of a high standard, and that they're reflecting advancements in technology, etc., that the industry is utilizing, so that it's real for people's lives.
Fantastic. And something just struck me then, because obviously you have your own chapter, but you're part of PDA overall as well. So how much stuff do you do which is unique to PDA Ireland as separate to what PDA do in general?
Most of what we do is unique to PDA Ireland. We collaborate as much as we can, mainly with PDA Europe. We're guided by PDA US, obviously, as the headquarters. We run an event, typically a combined event with PDA Europe once a year, and other than that, our activities are driven solely by the Irish chapter itself. So we would run about 4 events a year in terms of educational events, and therefore they are for seasoned healthcare professionals like myself, but also the up-and-coming professionals, ones that are maybe new into the area. Not all young, some of them are ones that are finding new careers in these COVID times, etc. So we've got young professionals, new professionals forum, as well as general events. So around 4 events a year, and then around that we do other things like bursaries. We have a research award. We're also involved in trying to make charity donations and things like that. So we're trying to do what we can across a number of areas.
Fantastic. So let's look back at 2020, which was obviously a very different year for many, many reasons. First question, if you want to describe last year, what one word would you use to describe it and why?
Ooh, turbulent, because of COVID. I suppose, yeah. I mean, hasn't COVID dominated everybody's lives in all aspects of our lives? And no less in the pharmaceutical sector, no less for me as president of PDA, no less for me as a consultant into the industry. It's been turbulent, everyone trying to adapt become, respond to be able to live with it, live with COVID, and make the best of it. And so I think for me, it would be the word turbulent.
All right, okay. And looking back though, I mean, obviously there's lots of trends that have developed because of what's happened in 2020. So from your perspective, what are sort of the key trends that you've seen come out of 2020 and positives actually out of 2020 as well?
Yeah, well, I see the trends in the industry generally. I see a rise in new technologies, cell and gene therapy, RNA targeted therapeutics. We're seeing it in the COVID vaccines themselves. And I think that that's fostering new types of collaborations between pharmaceutical companies, in the area of clinical trials, research,
Right.
big data management, pooling resources, tapping into additional expertise to find therapies for challenging diseases. All these things to me are wonderful advances, and the industry, I think, has been pushed towards them. The pace at which they're making these changes has accelerated because of COVID.
Sure.
I think those advances were starting to happen before COVID, but they're probably more accelerated now, and I think that that's a trend that I think will endure going forward, because it's harder and harder for companies now to find new medicines and be able to afford to bring them all the way through to market, and get the return on investment for the effort to bring a product to market. So I think it makes best sense for companies to be collaborating, and around the science for these new types of medicines is far more detailed, it's far more complex. It needs collaborative enterprises in order to really bring these new medicines, personalized medicines, to market.
Right. Well, that sort of touches on another question, which is, from your perspective, how do you feel the pharma industry has responded to the pandemic, and what lessons have been learned? I know you've touched a little bit about collaboration and so on, but what other lessons do you think have been learned from the past year for the pharma sector?
Well, I think it's been an incredible response. I mean, if you think about the speed at which vaccines have been developed, when you think, the time it typically takes to bring a product to market is what, 7 to 10 years, and that's even fast. It could be 15, and to get vaccines up and into place within the space of a year is just phenomenal. And that that acceleration in product development, I think, has been an incredible response to COVID, and it really shows what can be achieved when there's a real drive and a real desire to do something. I think that organizations are evolving. I'm seeing the pharmaceutical industry approach their business in a different way now. I think that evolution will continue coming out of COVID. I think the lesson being learned is that we've got to adjust more quickly. It was driven out of necessity because of COVID, but now we're learning and reimagining a better way of working, which brings us more into this collaboration space, working together to try and bring new medicines to market. And I think an emergence of a new normal. I think the world going forward for the pharmaceutical sector and how we do business is going to look different after COVID. I think that's both a challenge and an opportunity, and the flip sides of the same coin, aren't they?
Sure, definitely. So you mentioned though that the pharma companies, the organizations, are changing. So how have they changed, do you think, or what are they changing to?
Yeah, well, I think that I'm starting to see it happen, kind of a cultural shift within organizations where the drive is always to get a return on investment, and there's an OpEx drive. We have to be efficient, we have to be effective, but what we also have to be is we have to ensure that we've got high quality standard in our medicines. So to me, OpEx and quality are the flip sides of the same coin. Sure. And I think that there's that more holistic way of operating is becoming more a norm now. And I think that will bring more efficiencies. You know, quality when it's run properly brings efficiencies. It's not a cost. It's not an adversarial thing that companies should be afraid of. It's actually ensuring that we do things right first time and get products to market in a fast, efficient way. And I think that that emergence of that is a new norm. The focus on productivity, error, waste reduction, along with increasing quality, as something that goes hand in hand, I think is a new way of thinking that more and more companies are starting to embrace and to reflect it in their operations and how they do business. So optimizing the business processes to enable that, I think, changing the functional silos, moving away from those, data standardization, integration, sharing. By sharing our data on development and on our products, we're enabling these collaborations that we're seeing happening. And I think that that kind of emergence will continue. At least I hope it will.
Right. And outside of COVID, where do you see BioPharma focus is going to be in 2021? So what other emerging trends can you see? I know you mentioned a few, but what other emerging trends would you see outside of COVID for BioPharma?
I think innovative, disruptive technologies is where it's at. You know, there's a lot of companies looking at machine learning, AI applications. And it's not towards trying to make humans redundant. In fact, it's about trying to utilize the capabilities of humans in a way that makes more sense, minimize error, increase productivity. And I think that those types of initiatives are the future for us, really. It's about doing things smarter.
Right. And one question was obviously, I thought quite appropriate given that you're looking after PDA Ireland, is that Ireland in itself is a real hub now for BioPharma and Pharma. And a lot of companies have invested now, life science companies have invested in Ireland with their facilities. So I suppose as a person from the outside looking in, why?
Why? You have to ask. Ireland is wonderful. Yeah, no, I think there's a number of very, very good reasons for it. The government over the last 20 years has made a point of investing in the pharmaceutical sector, pharmaceutical and medtech, the life sciences in general, really. They saw it as an area where Ireland could become, could take the lead, and decided to go for that. And it did. So it did that through direct financial incentives for companies to set up and operate here, but also by supporting education. So there's a lot of very strong educational courses run in the various universities here in Ireland that are qualifying people who are very well placed to work in the pharmaceutical sector. So when you combine those two things, what you've got now is an experienced workforce. Because we're only 4 million in population, you get people moving around quite a lot. So you get a cross-breeding, or you get a cross-fertilization of the experience. You know, companies are able to avail of experience that people have gained in other companies, and the people are moving. And that is very productive for the industry in general. I think that that success has built on, success has built on success. And, you know, a lot of, I think, at this point, we have most of the multinationals represented here in the country in some form, whether it's manufacturing or distribution. And I think that basically that is why they're seeing, I think it's also our culture. We're known to be doers. We play hard, we work hard. We're problem solvers. And I think that that works well in the pharmaceutical sector when manufacturing environments, it's fraught with problems. And when you've got people who are roll up the sleeves, hands on, we sort it, we get it done, you know, the business is productive, then that's an attitude that a lot of companies welcome, particularly American companies. And I think that the combination of all those things makes us, you know, I guess a good location. I think now as well, given that with post-Brexit, given that we're the only naturally English-speaking country left in Europe, I think, am I mistaken on that? I think it makes us a very good springboard for Europe as well, and a lot of companies have identified that over the last couple of years. So Brexit has been a help here as well.
Right, I was going to ask you about that. I mean, given the let's say the teething problems that have happened post Brexit, certainly from the UK side, do you see there being any sort of long-term negative implications due to Brexit, or do you think it will be, because like you just said, you're in a perfect position, the only native English speaking country in the EU, you'll still have that dominant position, so maybe more so now because the UK isn't part of the EU?
Oh, I think there will be adverse effects for Ireland and the UK coming out of Brexit. I think different sectors are going to feel it differently. I think the pharmaceutical sector is somewhat insulated from a lot of these very significant upheavals generally, because medicines are always required.
Sure.
There's always a need that won't change whatever the political situation is. So therefore, I think the pharmaceutical sector in Ireland certainly won't be significantly adversely affected by it. I think they have to adapt how they do business. So how they distribute their products will have to change. Those that were distributing using the UK as a route to access Europe have had to change their distribution routes. That's cost them a huge amount of money to get those new supply chains into place. But the longer term, I don't think we'll see a negative impact for the pharmaceutical sector necessarily because of Brexit. I do think that other sectors in Ireland will feel it far more. But all of these significant changes that happen over time through all of the ages cause us to have to rethink.
Sure.
And that's not necessarily a bad thing. It just means that we have to adapt. We have to find different ways of doing things and doing new things. And that's life, isn't it? It's about getting on with it.
Yeah, well, very, very well. It's a very good attitude to have, and it makes sure that you're successful still, doesn't it? So, we were talking about, and you were mentioning about Ireland, and obviously the workforce, and that leads quite nicely to my last question, if I get my teeth in, which is, what has PDA Ireland been doing to support its members during the pandemic?
It's challenging, isn't it? Because we're all working from home and isolated and don't have access to people. I think what we're doing, we're trying to maintain our educational courses, and obviously we can't have them face to face.
Sure.
So we have adapted and we're embracing technology, different platforms like this one we're using today, Zoom, to deliver our events virtually and online. And that's working very well. Even in the way we deliver those, rather than just using presentations with people, faceless people in the background with lots of slide decks where you're just getting information thrown at you, we're adapting and we're doing fireside chats and we're doing these kinds of open conversations that you and I are having today. And the aim is to try and maintain that personal touch, a little bit of that personal touch, to make people feel that they still have contact with others. Networking is very important within our industry. Information and knowledge gets shared by people talking to people and by sharing experiences. Yep. We really need to adapt the way we communicate to enable that to continue to happen. And that's what we're trying to do in PDA Ireland, run our events so that we enable that and continue to attract new members. It's very important that we do that. The younger people, gosh, they're so technology savvy. It's absolutely amazing. It's wonderful. So they're embracing this kind of new technology and new way of interacting. It's more the older people like me that are struggling with it. Where do I get my sound? So that they are some of the initiatives that we're taking. I think that there's limitations in what we can do, unfortunately. Some of the other activities that we would have been doing, we would always support some of our members to attend PDA events internationally and come back and report on those and present on those to the Irish membership, what they learned, what new technologies they got out of it, what ideas they got out of it. That stopped because there's no travel and you can't go do that. So it's not the same thing to attend an international event online and report it back nationally. It just doesn't work. We're all attending them internationally online anyway. So there's some events we've had to kind of curtail, but in general, it's really trying to keep doing what we have been doing, but just do it in a more innovative way. Brilliant. Long way around answering your question. I hope
No, you have answered it. But and so that leads me to, has there been one particular thing that your members have said they've found an issue with because of the pandemic, or found difficult, that you've been able to help them with?
Not that I can think of off the top of my head.
Well, that shows you're doing a great job looking after them.
Well, this is it. I guess our sponsors are telling us that they're finding it hard, because obviously for us to put on the events that we do, we invite international speakers to present at our events, and that costs, and we've got wonderful sponsors that help us deliver on that. It's hard for them. It's hard for them at you know, in COVID to get their message out, I guess. So we are trying to facilitate that as well by giving them speaking slots in our virtual events to be able to tell us all about new technologies, etc., that they're able to provide to us in the industry. So maybe from that point of view, it's probably more the suppliers that are telling us they're having challenges rather than the members, to be honest.
Right. And so your chance for a plug now. So is there anything that people should look out for from PDA Ireland this year?
Yes, we are running an event on March the 11th, our next online event. You may know that there is an update to Annex 1 of the EU GMP guide on sterile manufacture. And this has been coming for years. It's the longest gestation period that I'm aware of, a very long time. But the update has been published. It's not yet in effect, but there's a lot of change. And we see there's a lot of interest amongst our members to discuss specific topics. So what we're doing is, it's a virtual online, couple of hours event. We've got a couple of really high profile people, experts in this field, and we're picking select topics, technical topics, and we're going to discuss them, the challenges of implementing the new requirements. So please join us for this event.
All right, well, we'll make sure we put the link above this video so people can find out more about that as well. So finally then,
Terrific.
last word then, what message would you give to everybody watching this for 2021? So almost like a Christmas message, but 2 months late, basically. So what would you like to say?
Well, what I would like to say is that COVID is with us, we're living with it, and I really think we just need to get on with it. It's making us look at life differently and do things differently, and in my view, that's not necessarily a bad thing.
Brilliant. Well, thank you very much. Well, and I know you're a very busy woman, so I appreciate taking time out to talk to me today. It's been really interesting. It's lovely to meet you as well. So on that note, I will wish you, PDA Ireland, your loved ones, everyone you know, a fantastic 2021. May it be happy and successful, and more importantly, healthy. And the same applies obviously to everybody who's watching. So thank you very much for your time.
Thank you, Rizwan.
And thank you, as always, for watching. And until next time, stay well and stay safe. Bye-bye.
Bye-bye.